Have you ever wondered what the scariest disease in history might be? Well, wonder no more. Today, we're diving deep into the terrifying world of pandemics, outbreaks that sweep across continents, leaving death and devastation in their wake. From plagues that ravaged empires to influenzas that circled the globe, get ready for a countdown of the 10 deadliest pandemics in human history. But before we get started, be sure to subscribe to our channel. After that, we'd be grateful if you leave a comment and let us know what unsettling historical topics you would like to hear about. This will be a wild ride, so let's get started. Number 10. Antonine Plague, 165 to 180 AD. Death toll, approximately 5 million. The Antonine Plague, also known as the Plague of Galen, was a devastating pandemic that struck the Roman Empire from 165 to 180 AD. It's believed to have originated in the East, possibly spread by soldiers returning from campaigns. The exact cause is unknown, but smallpox and measles are the leading suspects. The plague caused widespread death and social disruption. Estimates suggest millions perished, with some sources claiming a mortality rate as high as 30%. The Roman army was particularly hard hit, weakening the empire's defenses. Despite its severity, the Antonine Plague is less well known than other historical pandemics due to a lack of clear historical records. 9. Third Cholera Pandemic, 1852 to 1860. Death toll, over 1 million. The Third Cholera Pandemic, 1852 to 1860, was one of the deadliest outbreaks of cholera in the 19th century, originating in India, particularly the Ganges River Delta, and spreading globally. This pandemic notably affected Europe, Asia, North America, and Africa. In 1854, British physician John Snow linked cholera to contaminated water, pioneering modern epidemiology. The pandemic caused widespread devastation, with millions of deaths worldwide. Poor sanitary conditions and rapid urbanization facilitated the spread of the disease. The Third Cholera Pandemic underscored the need for improved public health measures and sanitation practices, leading to significant changes in public health policies and infrastructure, especially in urban areas. This pandemic highlighted the critical link between water quality and disease transmission. 8. Russian flu, 1889 to 1890. Death toll, approximately 1 million. The Russian flu, 1889 to 1890, also known as the 1889 to 1890 flu pandemic, was a global influenza outbreak that marked the first significant flu pandemic in recorded history. Originating in Bokhara, Central Asia, then part of the Russian Empire, it quickly spread across Europe, North America, and beyond. The virus, suspected to be an H2N2 strain, caused widespread illness and mortality, with an estimated 1 million deaths globally. The rapid spread was facilitated by advancements in transportation, such as railways and steamships. Symptoms included fever, body aches, and severe respiratory distress. This pandemic highlighted the need for improved public health responses and set the stage for modern epidemiology, influencing how future pandemics were managed and understood. Number 7. Hong Kong flu, 1968 to 1969. Death toll, 1 to 4 million. The Hong Kong flu, also known as the 1968 flu pandemic, was a serious global outbreak that occurred from 1968 to 1969. Caused by a new variant of the H3N2 influenza A virus, it infected millions worldwide and resulted in estimates ranging from 1 million to 4 million deaths. The virus spread rapidly, with young children and older adults particularly vulnerable. Symptoms were typical of influenza: fever, cough, runny nose, muscle aches, and headaches. While no specific treatment existed, supportive care helped manage symptoms. Interestingly, development of a vaccine was underway during the outbreak, but its effectiveness was limited. The pandemic subsided in 1969, but the H3N2 strain remains a seasonal influenza virus today. 6. Asian flu, 1957 to 1958. Death toll, 1 to 2 million. The Asian flu, also known as the 1957 to 1958 influenza pandemic, was a global outbreak caused by a new influenza A virus subtype H2N2. It originated in China in early 1957 and quickly spread throughout Asia, reaching the United States by summer. The H2N2 virus was particularly contagious and caused illness in people who had no prior immunity. The pandemic caused an estimated 1 to 4 million deaths worldwide, with children, the elderly, and pregnant women being most at risk. A vaccine was developed in 1957, but the pandemic had a second wave in 1958 before the strain became a regular seasonal flu virus. 5. Plague of Justinian, 541 to 542 AD. Death toll, 25 to 50 million. The Plague of Justinian, 541 to 542 AD, was a devastating bubonic plague pandemic that ravaged the Byzantine Empire and much of the Mediterranean world during the reign of Emperor Justinian I, 527 to 565 AD. Considered one of history's deadliest pandemics, it's estimated to have killed 25 million people, possibly half of Europe's population at the time. Originating in Egypt, the plague spread rapidly along trade routes, reaching Constantinople, the Byzantine capital, in 541 AD. The disease caused fever, chills, swollen lymph nodes, buboes, and death within days of infection. The pandemic profoundly impacted the Byzantine Empire's social, economic, and political landscape. It weakened the empire's military and economy, contributing to its decline in the centuries that followed. 4. HIV/AIDS pandemic, 1981 present. Death toll, 36 million plus. The HIV/AIDS pandemic, emerging in 1981, remains a global health crisis. Human immunodeficiency virus, HIV, attacks the immune system, leading to acquired immunodeficiency syndrome, AIDS, if untreated. Initially identified among gay men in the US, it soon became clear that HIV affects all demographics. The virus spreads through blood, semen, vaginal fluids, and breast milk. Antiretroviral therapy, ART, has transformed HIV from a fatal diagnosis to a manageable chronic condition, significantly reducing mortality and transmission. Despite advancements, challenges persist due to stigma, lack of access to healthcare, and socioeconomic factors. Globally, around 38 million people live with HIV, with sub-Saharan Africa being the hardest hit. Ongoing efforts focus on prevention, treatment, education, and ultimately finding a cure. 3. Spanish flu, 1918 to 1919. Death toll, 50 million plus. The Spanish flu, 1918 to 1919, was a devastating global pandemic caused by an H1N1 influenza virus. It infected an estimated 500 million people, one-third of the world's population at the time. Estimates vary, but the Spanish flu caused somewhere between 20 and 50 million deaths. The virus spread rapidly during World War I due to the movement of troops. Unlike typical flu seasons, which hit the elderly and young children hardest, the Spanish flu also struck healthy young adults. There was no vaccine at the time, and treatment options were limited. Public health measures like isolation, quarantine, social distancing, and mask wearing helped slow the spread of the virus. 2. The Black Death, 1347 to 1351. Death toll, 75 to 200 million. The Black Death, 1347 to 1351, was one of the deadliest pandemics in human history, causing the deaths of an estimated 25 to 30 million people in Europe, about a third of the population at the time. It was caused by the bacterium Yersinia pestis, transmitted through fleas that infested black rats. Originating in Asia, it spread via trade routes, reaching Europe through the port of Messina in Sicily in 1347. The disease manifested in 3 forms: bubonic, pneumonic, and septicemic, each with high mortality rates. The pandemic led to severe social, economic, and cultural upheavals, including labor shortages, shifts in economic power, and widespread fear and superstition. The Black Death profoundly reshaped medieval society, with long-lasting impacts on European history and development. 1. COVID-19 pandemic, 2019 present. Death toll, 6.9 million plus, and counting. The COVID-19 pandemic, caused by the SARS-CoV-2 virus, emerged in Wuhan, China in late 2019. It rapidly spread worldwide, prompting the World Health Organization, WHO, to declare a global health emergency in January 2020 and a pandemic in March 2020. The disease can cause fever, cough, respiratory problems, and even death. Lockdowns, mask wearing, and social distancing measures were implemented to curb the spread. Vaccines were developed in record time and significantly reduced the severity of illness. While the WHO ended the public health emergency in May 2023, COVID-19 continues to circulate. That was a heavy dose of history. These pandemics remind us of the fragility of human life and the importance of preparedness, public health, and scientific research. As we continue to battle current and future outbreaks, the lessons learned from these deadly pandemics are more relevant than ever. But they've also spurred medical advancements and international cooperation. The good news? Thanks to science and public health efforts, we're better equipped to handle pandemics today. But it's important to remember the past so we can be prepared for whatever the future holds. If you found this video informative, make sure to like, subscribe, and hit the bell icon for more deep dives into history and science. Thanks for watching. Let us know in the comments which pandemic you found the most intriguing and what other topics you'd like us to cover.